there's an incredible thirst for more technology that further improves quality, access, service, and convenience to our patients. But equally important, technology that will help our physicians handle the demands we face with clinical practice in today's world.
I think having physicians at the forefront of kind of defining those needs and requirements and then letting the information technology experts go out and build it is key.
Oftentimes, our reality is what we make of it. And so if we can help people kind of reframe, rethink, and help reconnect to their meaning and purpose, that can be very important.
Hello and welcome to the Permanente Medicine Podcast. I'm Chris Grant, your host, and the Chief Operating Officer of the Permanente Federation. On today's episode, we're going to discuss another hot topic in medicine as we look at the relationship between technology and physician wellness, how the tremendous innovation that has taken place in healthcare these last few years can help or hurt doctors, and what conversations we need to keep in mind for supporting their well-being. Technology has historically transformed industries, but it also creates complications and some unintended consequences for physicians in their day-to-day work. Joining me is my friend and Federation leadership colleague and returning guest to the podcast, Dr. Ed Lee. Dr. Lee is an internist and Executive Vice President for Information Technology and Chief Information Officer with the Permanente Federation. He also serves as Associate Executive Director with the Permanente Medical Group. Also on the show is Dr. Ruth Chang, a family medicine physician and Chief People Officer for Northwest Permanente in Portland, Oregon. Dr. Chang has also been a leading voice for Kaiser Permanente's equity and diversity efforts, and boy, have I seen Dr. Chang in action. Thank you both for joining me on the show today. I'm looking forward to learning more about the constantly evolving topic.
It's a pleasure to be here, Chris. Thanks for having me on the podcast.
Thanks, Chris. It's a pleasure to be here.
All right. Well, let's get down to business and provide some great insight for our listeners. The last few years has really been unprecedented when it comes to how technology is being integrated into every facet of healthcare. Even this podcast has gone high tech, with all of us joining today virtually for today's recording from completely different places across the country. I'd love to hear what both of you are seeing in terms of the benefits and challenges around technology becoming so integrated into the work of physician and care teams as a whole. Ed, why don't we start with you on this?
It's such a great question, Chris, because so much has been done, especially over the past few years, around the integration of technology into our medical practice. An example is the increased use of telehealth, which has been one of the most visible things that has changed since the start of the pandemic. This gives our patients more access to the high quality care that comes from Permanente medicine. It's convenient for our patients, and our patients report a high level of satisfaction while using our telehealth services. This was great because Permanente medicine has always been uniquely positioned in the healthcare marketplace to benefit from the shift to more virtual care because of our model of care. We've also been developing more advanced tools to make it easier for our physicians to do their work, tools that can help prioritize and distribute the work so that physicians are doing things that require the skill and expertise of a physician. Right now, though, there's an incredible thirst for more technology that further improves quality, access, service, and convenience to our patients. But equally important, technology that will help our physicians handle the demands we face with clinical practice in today's world. The care that we deliver can be highly complex, it can be high volume, and it's often happening at a very rapid pace. Rightly so, there's an expectation that technology will help us meet our needs of today and our future. So the challenge is to act nimbly, to do things quickly, but to do things in a way that protects our patients' privacy, complies with state and federal regulations, is done with resource constraints that we might have in mind, and are developed in a way that adds to what we ultimately are trying to do, allowing our physicians to do what they do best, which is to provide compassionate, high-quality care to our patients.
Yeah, Ed, that's such great points, because kind of the migration to virtual care and whether it's phone, video, chat, right? It creates extraordinary consumer experience, patient access, but there's all of these other needs and challenges, such as patient confidentiality and security, that need to be thought of. And if you think of the old days, right, you made an appointment with your doctor to go into the office during these, particular hours, and now patients will email their doctors at midnight or 6 a.m. in the morning, and appropriately ensuring that expectations are set and there's capabilities and technology to be able to respond effectively in a useful way is really quite critical. So such great insight. Ruth, same question for you. What are some advantages and what are some of the pain points with evolving technology coming out of the pandemic?
Yeah, great question, Chris. And I always like to think about, from the patient perspective. So Ed has already mentioned it's convenient for patients, and yet we need to think about protecting patient privacy. I'd like to deep dive a little bit more about the convenience for patients. I think it's not just about convenience and access to their doctor. You mentioned that patients can email their doctor and get straightforward questions answered in a really convenient fashion. But I also think more broadly, like, traditionally in the office-based model or clinic-based model, patients oftentimes would have to take a full day off of work to travel, arrange for childcare, or miss work and miss the pay, right? Because people don't necessarily have paid sick leave. And then they have to travel, park. There could be costs involved in that as well. So there's a lot of advantage to patients from a financial health perspective for them to access telehealth and get the same level of high quality care from their doctor. If you think globally, like environmental health has also improved because just people are not commuting. The physicians and the less staff are commuting when they're providing telehealth, and certainly the patient travel. All of that is good. I think some of the pain points, as Ed has already, pointed out, is around we've got to worry about protecting patient privacy. I've definitely had telehealth visits when the patient's like sitting in a room with other people, and I keep asking him, like, is it okay for me to ask you some really pointed questions about your health? So I worry about that. The other thing that I do think about too is telehealth equitable? Like, do our patients have equitable access to telehealth? Are folks able to have access to good Wi-Fi so that they can connect with their physicians for video visits? Certainly, we conduct telephone visits as well. But those are the bigger questions I have thinking about, is making sure that we're not leaving patient populations behind because of that difference in access to care.
Yeah, it's such a great perspective and kind of vantage point from the shoes of an individual patient and every individual patient, right, with different circumstances, different home settings in which they might be conversing with their physician or care team, and all the considerations that need to go into that. I want to stay with you, Ruth, for this next question. Physician burnout was a topic of conversation years before the pandemic. However, COVID-19 really seemed to exacerbate the issue. You spoke publicly, Ruth, about the recent uptick in burnout among physicians, clinicians, and healthcare workers. Could you share with our audience some of the warning signs that you're seeing and what we can do to address this troubling trend?
Yeah, absolutely. It's been an incredibly challenging 3 years. And as you've mentioned, Chris, even before the pandemic started, we were already experiencing high levels of burnout in the healthcare profession. And so I'd say the things to look out for, this is based on the Maslow burnout inventory scales, but things about emotional exhaustion. When we just feel like we're out of compassion, like that's a warning sign. Depersonalization, like it's hard for docs to see each patient as an individual. That's also another warning sign. And part of that too could be coupled with cynicism, when people just feel like they don't care anymore, right? Because we all came into healthcare, into the medical profession, out of a place of caring. And so when we lose that, like that, definitely deep signs of burnout. People can also feel a lack of personal accomplishment. And part of that is that they feel this lack of professional efficacy, that the work I do doesn't really matter anymore, or am I really making a difference? And those are definitely all signs of burnout. And burnout is a spectrum, right? So someone can be mildly burnt out and someone can be completely tapped out. And I think along with that is just, can we find that meaning and purpose in the work we do? because we know at the end of the day that, being a physician, the work is important. But when people lose sight of that importance, that's a clear sign of burnout. So the second part of your question was, well, what can we do, right? And really, the answers are, it has to be threefold. And so this is borrowing on the Stanford WellMD model. It's three domains that are interconnected. We've got to adjust systems, build a culture of wellness, and then also offer programs to support individual wellness. So I often say, more yoga at lunch is not going to solve burnout. So we can't put it all just on the individual, but we've got to look holistically. So on the systems level, what Ed already mentioned, are we making sure doctors are doing doctor level work? So do we have the staffing and the tools in place to really allow a doctor to do that highest level work, and then the rest of the support staff can take care of everything else? So that's that efficiency of practice. And then in that culture of wellness, like, are we truly encouraging each other to take time off and to disconnect when we're out of office? And are we, as leaders, modeling that type of behavior? So that's kind of building that culture of wellness. And then lastly, individual programs to support wellness is thinking about how do we help people prioritize their own self-care, maybe help them shift perspectives. Oftentimes our reality is what we make of it. And so if we can help people kind of reframe, rethink, and help reconnect to their meaning and purpose, that can be very important. And then lastly is also just to help people seek out connections, because we know from all the literature in workplace satisfaction, and it's not just in healthcare, but across the board, people are most satisfied when they have good, meaningful connections in the workplace.
Great guidance and insight. Ed, you are our resident innovation expert, and I've heard you speak directly to how technology can be used to help prevent physician burnout. You've also highlighted the importance of physician leadership in identifying tools and technologies that can reduce the administrative burden on medical staff and improve the quality of patient care. What are some ways Permanente doctors are leading in this area, and how do you see the work evolving in the months and years ahead?
Yeah, thanks, Chris. First off, I'm continually impressed with the innovations our Permanente physicians across all our Permanente medical groups are creating. And I'm a firm believer that some of our best innovations start as grassroots efforts within one medical center or even one small department. This is what happens when you pair really smart people with a mission-driven spirit who think creatively about ways to solve challenges that they and their colleagues face in their daily practice. We really could spend the entire rest of the podcast talking about dozens of examples, but I'll just mention a couple of buckets of innovation here. The first is the development of patient care navigation tools, which provide patients with guidance to obtain the most effective and efficient way to receive care. This is an area that really needs innovation because our physicians have limited amount of time. And so we need the technology to care for patients that's personalized, yet in doing so in a more automated way, such as through self-directed or self-help methods, including the use of things like e-visits. If our listeners aren't necessarily familiar with e-visits, let me just describe that quickly. This is where a patient can go online to seek care for common health conditions. For example, a cold or low back pain. They answer a series of questions about their condition, and by the end of the e-visit, the output can be a detailed treatment plan that helps set the patient on their path to recovery. And this often happens with little or no physician intervention. Another bucket of innovation I'll mention is in the area of AI, which I like to call augmented intelligence. It's an area I wanted to highlight since there's considerable thought and energy going into understanding how AI can meet our needs and how we can develop and deploy AI tools in the future. This includes our predictive analytic algorithms and other AI models that can offload some of the cognitive strain that is on our busy physicians. There are also tools that have been created to provide technical and digital assistance that make completing physician work easier. Examples of this include initiatives around natural language processing and voice recognition. So technology in general, I think, is one of the most important levers that we can pull to try to reduce administrative burden and to increase the quality of care. It's just a matter of tapping into this important tool to use our creative minds to make the most out of technology.
Boy, that's so spot on. And I think having physicians at the forefront of kind of defining those needs and requirements and then letting the information technology experts go out and build it is key. We're seeing dramatic shifts in doctor-patient relationships with the evolution of virtual care. What do you think we need to do to keep in mind for physicians and especially their well-being with more focus on virtual care? Ruth, why don't we start with you on this and then we'll turn to Ed.
Number one, I always think about like just the physical health of our clinicians. And based on my own experience, I remember doing my first block of 4 hours of virtual care with video visits. And it was so engrossing that at the end of the 4 hours, I realized I didn't move the whole time. Like I didn't even stand up. Whereas normally in clinic, I'd be up and down, walking between exam rooms, and so I just realized like, oh, wow, like we've really got to think about ergonomics, make sure our clinicians, if they're working from home, they've got sit-stand capability, or somehow encouraging or reminding people to take a quick stretch break. So I think just the physical labor that's required in front of a computer is very different than in the clinic, office-based setting. And then the other physical health part I think about is the eye strain, because staring at the computer screen all day is difficult. And then certainly the exposure to blue light could potentially interfere with sleep. So I think that's something we need to really think about and keep an eye on. So that's the physical health realm. But in the social health realm, I do worry about connectedness. Our clinicians being able to feel like they are connecting with each other. Now, I've seen great use of the Microsoft Teams chat. That's the platform we use within Kaiser Permanente. And so teams quickly would all get on the chat and the clinicians would just pop in questions. There's lots of activity going on. So people did feel closer in some ways with their colleagues because it was easy to communicate. But I will tell you, as we're gotten vaccines and kind of emerging from this crisis mode of the pandemic, everyone's saying, can we gather? Can we see each other in person? Like, I miss my colleagues. I just need to see them eyeball to eyeball and have that connection. So I think that how do we foster connection either through the virtual space or in person and be very intentional about that so that people can feel like they have a community at work.
And you're right. There are a lot of kind of physical considerations that don't exist in kind of a medical office setting, or at least to the same extent. But then there's also this kind of emotional well-being and interpersonal connectedness that we need to be cognizant about, right? And be proactive to ensure that we also foster that and reap all the benefits that can come from it and don't lose that in this kind of disproportionate shift to virtual care. Ed, I'm really curious in your thoughts here as well, and kind of what do we need to keep in mind for doctors and their well-being as we focus on this virtual care shift?
Yeah, there can be a lot of frustration when you have really great tools available to deliver virtual care, but you either don't know how to use it or you can't use it because of outages or downtimes. These tools have to be highly reliable since we're increasingly depending on these digital systems to take care of our patients. Thankfully, we've gotten pretty good at minimizing unplanned outages, but from a usability standpoint, we need to make sure technology is available that is simple and as intuitive as possible. Sometimes the best tools are the ones that require little or no training. Another important part of the technology is that it's not a standalone product. The power of technology comes when it's aligned with our mission and is integrated with our operations and into how we work. And I often think of our delivery system as a team sport. The physician might be the leader of the team, but it takes other team members to win the game. That's our nurses, our pharmacists, medical assistants, social workers, and so on. And a really good example of the team in action when it comes to virtual care is virtual rooming for our video visits. This is where our medical assistants contact our patients ahead of their video visit to make sure the technology is set up and the patient's ready to go. And during this time, the medical assistant can use the opportunity to close care gaps and to make sure the patient is up to date with their cancer screenings and immunizations. So it's a win for quality as well. Helping the patient with this helps our physicians too, so that our physicians aren't waiting for the patient to get connected to the video appointment. What's additionally impressive about this workflow is that it helps close the digital divide. In studies that we've done around virtual rooming, we saw greater increases in video connection rates for our patients who live in low socioeconomic status neighborhoods, and in our Black and Latino patients as well. And so in the end, it's really about providing the support for our patients and our physicians who need to receive and deliver the virtual care.
It's great insight. At the center of this rapid advancement in technology are the frontline physicians, clinicians, and care teams who interact with technology every day, specifically using the electronic health records or, as we've been discussing, virtual platforms. How important is it for doctors and clinical staff to play a role in technology innovation and its design and development? Ed, let's go with you for this one.
Oh, Chris, our physicians and other clinicians are indispensable with their role in technology innovation. So I'd say it's more than just playing a role. It's owning it and leading it. And in fact, it's in our DNA of Permanente medicine and something that continues to propel us forward towards current and future success. The skills of our Permanente colleagues go well beyond just knowing the science of medicine. It's also the deep understanding of the operations behind how we deliver care, and not to mention knowing how to do that with compassion and empathy. All of our skills and knowledge serve as a foundation to our technology innovation, which in the end drives high quality care, exceptional care experiences, and solutions that are best for our patients and for our physicians and their care teams. Overall, physician leadership is the way Permanente medicine will continue to stay at the forefront of everything that we do. Having experts who understand the end-to-end experience is critical, all the way from before a patient first comes in contact with our delivery system to what it looks like when the patient's care needs make their way in front of a physician. Each step in that entire journey has nuances and details that are ripe for continued innovation. And who better to innovate than our physicians who are living that experience every day?
Ruth, I'd love to hear from you on this. What do you think is the key to empowering physicians to be involved with their development of new technology?
Yeah, absolutely. The empowerment piece is we ask, right? So I think it comes back to that two-way communication between the leaders and the core staff who are doing the work, is getting out there, rounding, checking in on folks and asking for the ideas. What are the pinch points and how can we solve them? And so it's really asking all of our clinicians to be part of that solutioning. As Ed has already mentioned, this is about having our end users be part of the design team. And so I think one great model is in the Northwest, we have our Health Connect or medical informatics champions. So every single department has a physician who's part of the design and build team. So they're talking with their medical informatics expert who can do the build, but the physician's really informing them of this is what our department needs. This is how the patient workflow, really exists. And so this is what we need in order to really design those decision support tools that's built within the EMR. And so that's how we really make sure we include the voice of the clinician in a very practical manner.
And for our listeners, we also have patient and member focus groups so that we can marry that patient experience and their feedback, what worked, what didn't work, with the clinical care team's insight in order to make it, an optimized experience. I want to take out our crystal ball here before we wrap up. This has just been a really wonderful conversation. And I want to ask each of you to kind of look into that crystal ball and offer our listeners a little glimpse into either something you're working on now or possibly an effort that you envision on the horizon that excites you in the space of application of technology and its coordination and fit with physician and care team well-being. Ruth, why don't we start with you and give us your kind of best look into the future?
Well, there's two things I want to share. One is an idea that we're exploring now, and two is one idea that I think would be incredible for the future for all the patients in our communities that we serve. So one is leveraging tech platform to foster more connectedness. So there are existing platforms that really help facilitate mentoring relationships. So that's one thing that we're investigating and looking at. And the whole idea is, how do we improve connections across the medical group? And really, I think about, we wear fitness trackers, like, right? A lot of people have fitness trackers that are tracking our heart rate, exercise, sleep. But how about leveraging some application that focuses on our career development, focuses on our connectedness, reminds us to reach out to our colleague and check in on them. So that's what I'm excited about, is, again, how do we really leverage building connection with each other? The bigger picture in the future, in this whole tech space, I would love for patients to ultimately own their medical records. Like, imagine if we had some secure cloud-based system in which patients truly own their records and it followed them no matter where they went, so that there isn't that, gap in medical history or knowledge that patients, just might not be clear what they had done previously. I think that is a huge opportunity for us to really have healthcare cost savings, because we're not going to be doing duplicate tests in the past. Empowers patients to know and own their history, and then allows physicians to have that more complete view of patients so we can deliver the best care possible. So that's a big, wish list in the future, but we could be the ones leading that conversation.
I mean, you're right. We've got these fitness trackers that tell us you've been sitting too long and it's time to get up, or take another walk at 8:00 at night, and you'll hit your goal for the day. But we don't necessarily have those same kinds of prompts to say you need to reach out to your clinical partner or your care team and check in on them. Ed, what do you see in your crystal ball on the horizon?
Yeah, Chris, there's been a ton of buzz around this lately, especially in the past few months. That's chatbot, ChatGPT. And Google recently announced their version of ChatGPT called Google Bard. Wouldn't it be great if we had a tool that a patient could use to answer any assortment of simple questions? And wouldn't it be great if physicians had a tool that could give us information right at our fingertips about clinical decision support and care guidelines, or provide assistance for any variety of administrative tasks that burden our practice? This would be a big time saver for both our patients and our physicians, and would support our value-based model of care, and would augment a physician's ability to make the best decisions possible together with our patients. As incredibly exciting as it is, though, I don't think we're quite there yet. We need to tap into knowledge that contains the best evidence-based information available, ideally with data that is up to date and unbiased, so that we're ensuring the delivery of equitable care to all of our patients. The output is only as good as the data used to train the AI model. So misinformation and biases can be perpetuated with the use of these tools. ChatGPT it's not HIPAA compliant, and so we shouldn't be entering any patient protected health information or any sensitive information, though future chatbot iterations could certainly be HIPAA compliant. Also, these responses from these tools might sound great, but might not actually be factually accurate. So, when we start using these in clinical care, it'll be important to double check the accuracy of these responses. Nevertheless, though, we're closer now than we have ever been, and I really can't wait to help shape the use of chatbot technology into our clinical practice in the future.
I love it. It all sounds really incredible. And, the crazy thing is, it's not that far on the horizon. Everything that both of you described is far under development. And it's really being kind of tooled to work within a healthcare environment today. We've covered some great ground on an important topic today, and I'm so grateful that you both were able to join for this conversation. It's important to remember that with all technology, there's always a human behind it, a human that helps design it, think through its capabilities, And I can't tell you how appreciative I am of the work that you both are doing and how comfortable I am knowing that you are two of the key physician leaders that are sitting behind that technology and making sure that it's developed in the right way and that it's used in the right way. Ed and Ruth, thank you so much for joining me today. Can't wait to see your work front and center in the months and years ahead.
Thanks, Chris. It was an honor to be here today to discuss such an important topic with you and Ruth, and such an exciting area with massive potential. I'm just glad to be part of the conversation.
Yeah, absolutely. I echo Ed's sentiments. Thank you, Chris. Thank you, Ed, for the conversation. And I really look forward to seeing what we do for our patients.
Well, thank you both. And thanks again to our listeners for tuning in. We hope you found this episode of the Permanente Medicine podcast insightful. Please take time to subscribe on your favorite podcast streaming service. We're on just about every streaming platform, and we always welcome your review. We'll see you next time. The opinions expressed on this podcast are those of the speakers and are not necessarily the views of Kaiser Permanente, the Permanente Medical Groups, or the Permanente Federation.